Welcome to Pharmacology Made Practical. This is lesson 1. We're going to be talking about from use to disease and understanding addiction. We're going to lay the foundation for everything else in this course. My name is Desiree Cochran-Norfolk. I am an addiction counselor. I have a master's in addiction counseling, and I'm certified by the Georgia Addiction Counselors Association as a certified clinical supervisor, a certified master addiction counselor, and a CAC2. I'm also certified through NADAC as an SAP and the Georgia Commission on Family Violence as a Family Violence Intervention Program Facilitator, and I am also certified as an anger management specialist. So before we start talking about brain chemistry and relapse and treatment, we have to first understand what addiction actually is. And I really want to be clear, how we define addiction is going to directly impact how we treat our clients. So if you see addiction as a choice, your approach is going to look very different than if you see it as a disease. So this lesson is about shifting perspective and strengthening your clinical lens and making sure that your understanding is aligning with what we know from science and from practice. And I also want this to feel practical, not just theoretical. So throughout this lesson, you're going to be asked to reflect and apply and think about your own client needs. There's no grades here, but there is growth. So be honest with yourself as you're going through it. Some of what we talk about may challenge your beliefs that you've held for a long time, but that's okay. This is kind of just part of becoming a stronger clinician. And by the end of this lesson, you should feel a little bit more confident explaining addiction, not just to your clients, but to families and courts and even other professionals. So let's get started. So by the end of this lesson, there's a few things that I want you to walk away with. First, I want you to really clearly understand what we mean when we say addiction is a disease. Not just repeating the phrase, but actually understanding what that looks like in real life. And then second, you should be able to identify the core characteristics of addiction. Things like loss of control, progression, and relapse. These are not random behaviors. They're patterns that we see consistently across clients. And then third, I want you to understand how the field has evolved. Addiction wasn't always viewed as a disease, and some people still don't see it that way. And we are going to encounter judges and family members and maybe even other clinicians who still operate from that moral model. So part of your role is being able to explain the disease model clearly and confidently, because this is not just knowledge for you. It's something that you are going to actively use. So throughout this lesson, I want you thinking about your current and your past clients, and where do you see these characteristics showing up? Where have you maybe misunderstood something in the past? This is a chance to refine your lens and take it seriously, because this foundation matters for everything else that we do. So before I give you any definitions, I kind of want to hear from you, even if it's just in your own notes. And I want you to hear from yourself. Take a moment just to write down how you are personally defining addiction. Not what a textbook says, not what you think I want to hear or what other people want to hear, but what do you actually believe that it is? Is it a choice? Is it a habit? Is it a coping mechanism? A disease? Something else? Be honest. Just take a moment and pause and write your definition down. The reason that this matters is because your beliefs are going to influence your clinical decisions more than you realize. So if part of you believes that a client should just stop, that belief is going to show up in your tone and your expectations and your level of patience. Now, once you have written your definition, I want you to think about, where did that belief come from? Did it come from your upbringing, your education, maybe your personal experiences, maybe your own recovery, somebody close to you, their journey? It's not right or wrong here. This is just about awareness. And so as we're moving through this lesson, I want you to compare your definition to what we're discussing and notice what's aligning and what doesn't align, because growth is going to start with that awareness. So don't skip this step. This is your baseline. Now, let's talk about addiction and how it's been viewed over time, because this context absolutely matters. Historically, addiction was seen through this moral lens. People believed that individuals who used substances were weak, or they lacked discipline, or simply just made bad choices. And that led to shame and punishment and exclusion rather than treatment. And then we saw the rise of the criminal model. This is where substance use was handled primarily through the legal system. So instead of asking, what's going on with this person? The system asks, how do we punish this behavior? And, while accountability is important, punishment alone isn't going to treat addiction. We've seen this revolving door of people just going in and out of jail. And the maximum sentences or the mandatory minimums and 3 strikes and you're out, obviously that doesn't work because people just keep coming back. And over time, the research began to show that addiction involves actual changes in brain function and behavior and the physiology of the person. So this led to the disease model, which, the disease model views addiction as a chronic medical condition that requires treatment and management and support. So here's the important part. Even though the field has evolved, all 3 models still exist today. So you're going to work with people who believe that addiction is a choice or a crime or a disease. And your job is to stay grounded in evidence while navigating through those perspectives. Understanding this history is going to help you do that without really getting frustrated or reactive. So again, when we're talking about addiction as a disease, I'm not using that term loosely. There's specific characteristics that define it. So first, addiction is chronic, which means that it doesn't just go away after a short period of time. It's going to require ongoing management, just like diabetes or hypertension. Those require ongoing management as well. And second, addiction is progressive. This means that over time, without intervention, it tends to get worse, not better. So what starts as occasional use can develop into dependence and loss of control. And then third, addiction is relapsing. So this is one of the most misunderstood aspects because we need to change that perspective and not look at relapse as a failure. It's part of the disease process. Just like somebody with asthma might have flare-ups, individuals with substance use disorders might experience relapse. And that doesn't mean that the treatment didn't work. It just means that the condition requires continued attention. So as counselors, how we're responding to relapse matters. If we see it as a failure, our response is going to be different than if we see it as a signal for adjustment in the treatment. So I want you to think about a client that you've worked with who struggled with relapse. How were you interpreting it at that time? And how might you interpret it differently now? See, this is where things get a little bit uncomfortable because we have to hold 2 truths at the same time. Yes, initial substance use is often a choice, but addiction is not simply about that first choice. Over time, the repeated substance use changes the brain in ways that impact our decision making. It's going to impact our impulse control and the way that our brain does reward processing. So what may have started out as voluntary behavior can become compulsive. So this is why telling somebody to just stop is not going to be effective. Because if it was that simple, between the making the choice and not making that choice, they would have already done it and we wouldn't be in this field. So as counselors, we need to understand the difference between choice and compulsion. We also need to be careful not to oversimplify addiction. It's not helpful to say, oh, it's just all a choice or it's no choice. The reality is a little bit more complex than that. And when we're understanding that complexity, we're going to approach clients with more empathy and more effective interventions. So think about how this is going to impact your language. Are you using words that are implying blame? Or are we using words that are reflecting understanding? Because the language is going to matter more than we think. So now I want you to pause and I want you to just think about a specific client, somebody that you found challenging. Maybe they were resistant, or they had relapsed a couple of times, or they didn't really seem motivated. And I want you to picture that person very clearly. And then I want you to ask yourself, how did I view their behavior at that time? Did I see them as non-compliant or difficult or not ready? Now what I want you to do is reframe that same client, using the disease model. If their behavior is a symptom of a chronic progressive condition, how does that change your interpretation? Does it shift your frustration? Does it increase your patience? Does it change how you would approach them today? This exercise is important because it's going to help you move from judgment to understanding. And that shift is what makes you a little bit more effective as a counselor. So I want you to take just a few minutes to actually think this through. Don't just move on. You can hit pause. This is where the real growth is happening. So understanding addiction as a disease is not just about theory. It has a real world impact because it's going to reduce stigma. When the client understands that their struggles are not simply just a result of being weak, they're more likely to engage in treatment. And then second, it's going to improve treatment outcomes. When we approach addiction as a condition that requires ongoing management, we're creating a more realistic and effective treatment plan. And then third, it's going to support long-term recovery. This disease model, it's encouraging continued care. We're encouraging relapse prevention and support systems and things like that. So it's moving us away from the idea of this quick fix, and it's moving us towards sustainable change. But here's the thing. The disease model is only going to work if you actually believe it. So if you say it, but you don't fully embrace it, your practice is not going to reflect it. And clients can feel that. So this is more than just learning. It's about alignment. Do your beliefs, your language, and your interventions all reflect the disease model? If not, this is going to be your opportunity to adjust that. So before we move on to lesson 2, I want you to complete a short assignment. First, I want you to rewrite your definition of addiction based on what you've learned in this lesson, and then compare it to what you wrote earlier. Look at it. What changed? What stayed the same? And then I want you to list 3 ways that this understanding is going to impact your counseling approach. This could be how you respond to relapse, how you talk to clients, how you're setting expectations, or how you're working with families. I want you to be specific. This is not for a grade. This is just for your development. So the more honest and thoughtful that you are, the more you're going to get out of it. Because this course is really designed to build your competence, not just give you information. So take your time with this, and when you're done, you'll be ready to move on to lesson 2, where we're going to go a little bit deeper into what's actually happening in the brain.